Did you know 1 in 2 men and 1 in 3 women are at risk of developing cancer at some point in their lifetime? Cancer touches people of all ages and backgrounds, male or female. With today's advances in medicine, more and more people are surviving a cancer diagnosis. However, surviving cancer can cost you thousands of dollars in expenses each year. Dealing with cancer can be emotionally difficult, as well as financially stressful for you. Cancer patients have often found their health insurance doesn't cover all their expenses, such as hospital deductibles and coinsurance or copays, or long convalescence and out-of-town lodging at a specialty treatment center. These expenses don't include the normal living expenses that must be met each month, like the mortgage or rent, utilities, food, transportation, and clothing. If you're diagnosed with cancer, how difficult will it be for you to pay the bills? 1 in 5 people diagnosed with cancer use all or most of their savings to pay for medical and living expenses. It's a frightening reality for many. Fortunately, our supplemental cancer plans may help offset the financial burden. Our policy provides benefits that can help pay toward hospital confinement, surgical operation, radiation therapy, chemotherapy, blood and plasma transfusion, and transportation expenses. You choose the amount of coverage that meets your needs. The hospital confinement benefit pays a specific amount for the first 12 days, and half the amount thereafter when you're confined in a hospital as a result of cancer treatment. Our cancer policy also pays up to a certain amount for approved operations. The radiation therapy and chemotherapy benefit pays up to a maximum amount for the life of the policy. This policy also pays up to a maximum amount when you receive a blood or plasma transfusion. The transportation benefit pays up to a maximum amount toward the cost of transportation to a hospital in a common carrier. For example, if you are transported to the hospital in a plane, bus, or train, this benefit covers the cost up to a certain amount. If you've never been diagnosed with cancer, you're eligible for our supplemental cancer insurance policy. Coverage begins 60 days after the policy is issued. Your representative will review the outline of coverage and policy with you. If you qualify for our cancer policy, you can help relieve the financial stress cancer can cause. You can't predict if you will get cancer, but our coverage can help you be prepared if you do.